You also see, I'm hitting record as well, just so everyone is aware. But in the chat, you will see a link to this survey as well. Feel free to, again, take it. It's voluntary, it's anonymous, and it will just give us some information and insight into your experience. What was it like joining the Learning Community series? Okay, a bit of housekeeping before we get started, just to keep in mind, today's session is being recorded. We are going to be hopefully having some engagement with each other, some dialogue with each other, not only you and I as training attendees and facilitator, but also some dialogue between you and your colleagues, right? To hopefully get some benefits from co-learning. I really believe in co-learning, and that comes with dialogue. So thinking about today, let's make sure that we are leading with curiosity and hopefully some engagement. I know you all are very busy, and to carve out 60 minutes to attend a training session, you want it to be relevant, you want it to be applicable, something you can utilize in your day-to-day. And we create that intentionality by engagement. My quick little guidelines for today, I just want to emphasize, again, we are looking at co-learning from one another, but also that we are maintaining respect and dignity and having a culturally responsive virtual space where everyone's beautiful and complex identities are honored and respected. And for our session, we are going to be talking specifically about today restorative supervision. We're going to be looking at burnout, looking at the impact of supervision, as well as the impact of burnout on the individuals that we supervise, right? Our staff, our supervisees. And then we're looking at approaches to reduce burnout using some restorative supervision approaches. So thinking about our topic, I would like for you guys to spend some time in a breakout room thinking about your supervision. I know in the chat, many of you have identified that you are currently in supervisory roles, working at Goodwill, working at Western State Hospital, the Hero Housing Program, right? I would like for you to speak with one another in a breakout group room and chat a little bit about your approach to supervision. And if you could touch upon the three questions here, how frequently do you meet with supervisees? What is your supervision format? And what does your supervision agenda look like? Right? How frequent do you meet? What's the format? And what's your supervisory agenda when you meet with people, folks? When I'm going to put you in those breakout group rooms, I will see you back in about, let's give it like 3 to 5 minutes. All right, folks, any questions before? If not, I will see you in 3 to 5. It looks like the room closed. Let me just do that again. My apologies. Continuing our discussion. And so thinking about that, right, it's important to consider, what are we doing in that time frame? What does supervision look like? And I saw in your responses, and thank you so much in the chat, that there was a lot of discussion of potentially normative supervision or formative supervision. So normative supervision is known as evaluative supervision, and that approach is primarily focusing on assessing and evaluating performance, looking at the standards, looking at the criteria, the job description. So, it might look at documentation timeline, the quality of a goal plan. You might assess where the person is at in terms of development, their professional development, and where they want to be, where they're going, right? Their goals, their professional development goals. Purpose of normative supervision is to ensure that a supervisee, their work is meeting standards of quality and performance, and that they are moving in the trajectory that they want to be moving in regards to their mobility in the agency, right? Promotions, aligning themselves for promotional opportunities. Normative supervision often includes the setting of performance goals and evaluating progress. So it's really hierarchical, meaning that you are taking more of a directive approach, a supervisory approach. You're not coming alongside. You have an evaluative feature here, right? That hierarchy is a little bit more prominent in normative supervision, right? If someone's not doing their progress notes, you may have to come to a point where there might be a corrective action, right? It moves from supporting them, assisting them, removing barriers, giving training, to then potentially following up with disciplinary action. When thinking about normative supervision, it's not just directive, it's also evaluative, there's feedback, there's standards for providing normative supervision, right? You know what best practices are with, or what your policies and procedures are, best practices, informal approaches to what needs to get done in the department or your office. The emphasis really is on measuring and maintaining compliance with established norms and expectations. Normative supervision might involve, again, giving a specific example, again, documentation training, doing the golden thread training, and then assessing that staff's performance on how they're doing. So that's normative supervision. And we heard some examples of normative supervision, the professional development, going over the goals, going over the progress. Formative supervision is also known as developmental supervision. And this is a supervisory approach that emphasizes professional growth development. It focuses on collaborative learning, skill enhancement, and ongoing improvement. Formative supervision is helping the person to really focus on their ability to utilize, to leverage evidence-based practices, evidence-informed practices in terms of service provision. It will include service conceptualization, thinking about how to work with a person, best approaches in developing interventions and strategies, objectives, really getting competent at the various evidence-based practices and interventions offered within your program modality. The primary purpose of formative supervision is to support the supervisee in learning and becoming competent in service provision. There's this allotment of time to reflect on their development, provide feedback, skill build. Skill building is very heavy in this particular area, right, of normative supervision. Formative supervision. Formative supervision is more collaborative than normative supervision. There's more open communication, self-assessment, self-directed learning. The supervisor, you, serves as a mentor or facilitator of growth. And this might look like regular discussions between your staff in terms of how they're doing with job development, right? If we're thinking about that SE model. If we're thinking about that supportive housing model, it might be, how are you in building skills of activities of daily living? Or if you're focusing on that vocational piece in supported housing, you too might be having that conversation about job development. What we don't see a lot of, right? We're really good at providing that normative supervision and that formative supervision. That may be our default, right? We're meeting the needs of the agency through normative supervision, getting them to follow policy and procedure, and we are meeting their needs in terms of the staff person with formative supervision, helping them to develop, to grow. Where we see potential need and potential area of a gap, if you will, a gap in our supervisory approaches, is the infusion of restorative supervision. Restorative supervision is commonly applied in various health professions settings. This can include, medical healthcare facilities, social work, counseling. It creates a collaborative and healing-oriented supervisory relationship where the well-being and the growth of the supervisee are prioritized. The ultimate goal of restorative supervision is that the supervisee becomes effective in wellness management, in making ethical decisions based on this particular area of growth, and developing resilience in the professional field. Restorative clinical supervision ultimately supports individuals in addressing their own wellness needs in relationship to the job. When we are working in our field, there is a cost to utilizing, leveraging empathy and sitting with a person and being present to respond, to support, to assist, to walk alongside and accompany individuals experiencing mental health symptoms, crisis, trauma. I think of trauma and all the multitudes of ways that individuals in the public mental health service sector experience trauma, and it's highly prevalent. So there is a cost to the job that we do in the public mental health service sector, and restorative supervision is a way to support individuals, right, in mitigating that cost. So thinking about those definitions of supervision, where do you find your default? Are you the type of supervisor that is frequently providing that normative supervision, following, mainly the policies and procedures? When to get your progress notes, goal plans in? Did you show up on time? How many hours are you out in the field versus in the office, right? That's the normative supervision. Are you primarily focusing on formative supervision, where you're focusing on skill development, building their clinical skills, building competencies? Or do you focus on restorative supervision, where you're helping the practitioner to unpack the emotional toll and support them in developing resilience to address that emotional toll of the job? Go ahead and put in the chat. Do you find that you have a default? Where is that default? Do you distribute your time and efforts with supervision, those supervisory sessions, across all three? It'd be interesting to see what you say. So thinking about restorative supervision, it can offer, right, a lot for an individual, including emotional support in a safe place for check-ins. Supervisors, when utilizing restorative supervision, are going to allow for their staff to check in, to discuss challenges, to, quote unquote, like vent in terms of finding their areas of challenge, difficulties, to express what they're processing as they're helping individuals. We're not providing counseling services to our supervisees, right? This is going to be in alignment with our boundaries, our good ethical boundaries, but we are going to help staff process, right, that emotional toll and their responses in terms of the work that they're doing, right? How are they managing certain stressors on the job? For Murky, I use a mixture of all three depending on the staff and the situation. Excellent. That's awesome. I'm so glad to hear that. Anyone else, feel free to put in the chat. So thinking about restorative supervision, it reduces stress and builds coping strategies for the staff, right? Effective restorative supervision can help individuals to manage their stress better, right? They feel that they have an individual to connect with, to talk about challenges, to address challenges, and this will ultimately prevent burnout. And we're going to talk about that in a second. It helps with workload management. You can have good discussions with the individuals that you're assisting in terms of supervision. And in that supervisory role, you can look at helping them to prioritize tasks, setting realistic goals. And it's also a way that we model those things, right? Our restorative supervision absolutely is a part of what we do and what we model. Perfect example, I had one supervisor who prided themselves on never taking vacation. They would talk, oh, it's been 5 years since I've had a vacation. What tone does that set for the staff? Does staff feel like they can take time off? What is that person implying in terms of their value? Go ahead and put it in the chat. Restorative supervision offers recognition and validation for a supervisee in terms of what they're experiencing, whether it's experiencing symptoms of burnout or in terms of challenges with their job and providing competent evidence-based services. Thinking about restorative supervision, it's an opportunity for that professional growth and engagement. People can disconnect from the field. Turnover and tension can be so very high for some agencies, as well as their actual rate of turnover. And so when we engage in restorative supervision, we engage staff. We re-engage staff in the job, an opportunity for professional growth. Okay, let's see. Work-life balance is definitely something that needs to be modeled by supervisors. Yes, absolutely. It starts with that modeling. We convey, right, quietly, silently, a message in what we do. And if we're not taking time off, if we're expecting everyone to answer their phones on the weekend, or we're making calls on the weekend and emailing, etc., right, that sets the tone that there's no boundaries. And that's not sustainable, right? Formative supervision has a whole host of benefits, including assisting in that work-life balance. Sometimes it may include job redesign, right? Supervisors can influence how tasks are allocated, how individuals are assigned when new referrals come in to better align with an employee's existing strengths, interests, as well as their bandwidth, right? So thinking about supervision, especially restorative supervision, this is a moderating factor for staff. What do I mean by that? Well, when we see individuals, supervisees, who go without supervision, or restorative supervision, quality supervision that includes restorative supervision, right? Their intention to leave, that's turnover intention, goes up, and their actual rate of turnover, that rate of tenure decreases, or that rate of turnover, right, inversely increases. So when you have supervision, right, let's think of the conversely, what does that look like? When you have supervision, it can decrease turnover intention, it can decrease turnover rates, and it can increase job satisfaction. Supervision is a way to, again, re-engage staff and increase their rate of tenure. And there's a whole host of reasons for that. Again, you're offering the staff person support and guidance, which helps people to stay at jobs, to stay longer. What's the saying? People don't leave jobs, they leave supervisors. And so we want to demonstrate that support and guidance. That is key for individual satisfaction. Professional growth and development, again, when you're providing that restorative supervision, it helps the individual to focus on their development, right? They have the bandwidth to do so. And we'll talk about that diminished bandwidth in a second. And it addresses burnout and stress. And that's where the bandwidth really can be impacted significantly, right? If a person is burnt out, and that's such a buzzword, but we're gonna talk about it in a second. If a person's feeling burnout, then they don't have that bandwidth, that mental energy, so to speak, to focus on development, right? So thinking about burnout, most people have an intuitive idea what it is, but from a research perspective, burnout is associated with feeling hopeless and having difficulties in dealing with the work that you are doing or doing your job effectively. So there are a whole host of negative feelings that have a gradual onset. There's stages of burnout, and we're going to go over those 5 stages. And they can reflect the feeling that your efforts do not make a difference, or they can be associated oftentimes with a very high workload, or non-supportive work environment. Burnout is a feeling that can be akin to worn out. It can affect anyone in our profession. The impact of burnout emerges, again, gradually over time, and it can be identified to added stressors that filter out, not just in our work life, but in our personal life. It doesn't stay siloed. As burnout develops, it creeps into other domains of our life, right? Not just working, right? Living, learning, working, social. It goes everywhere. Burnout can impact our drive, our motivation, enthusiasm, and it really strips away the passion that we once had for the work that we did. There are many unhealthy, unhelpful strategies that can be a trigger for burnout. And these strategies, let me know in the chat, can often be times associated with the quote unquote star employee, right? Your star employee might be seen working long hours. Working long hours consistently is a factor for burnout. Taking it all on, not delegating, just taking it all on, again, might be something associated with your star employee. That is a contributing factor to burnout. Not taking breaks. Oh, look at this person. They're working through the lunch, right? Oh, that's the star employee. They just keep going, going, going. Can be a contributing factor to burnout. Not saying no, right? Continually, and this goes with not delegating, continually taking on additional tasks, right? This will lead to burnout. It's not sustainable. Bottling things up, not sharing and processing with the supervisor in restorative supervision how they're feeling, that they're feeling overwhelmed, right? Not reaching out for that support, not disclosing, where their challenges lie in the work that they're doing, keeping that all internal. That can lead to burnout. But on the outside, that star employee, oh, they're fabulous. They don't ever have any complaints. They don't have ever have a challenge, right? No, this is a red flag. That's not something to be excited about. That's a red flag. Being a perfectionist, right? That is a red flag as well. That can be a trigger for burnout. Taking on or taking work home with you. Again, it may be something that we say, oh, this person's, look at them. They're so committed. They're taking their work home. This is a red flag for burnout. Any others that you can think of, put it in the chat. Compassion, but yeah, catch compassion fatigue before burnout. Absolutely. That's a great point, and we'll discuss that in a few slides. Absolutely. Compassion fatigue is that precursor to burnout. So thinking about burnout, you want to be mindful of this triad right here. People who are experiencing burnout have limited emotional resources, that emotional exhaustion. They have limited resources emotionally to bring into encounters with others. They feel overextended, overworked, numb, apathetic to situations that normally would have led them to feel empathy or compassion. And so when I was supervising, this would look like, one of my star employees getting ready to see a person in a vocational setting. I don't know why I'm seeing Seth tonight. For services, he's never going to get a job, right? I don't know. I don't know why. So they were feeling emotionally exhausted. They felt extremely challenged by working with this individual. And so they felt very apathetic. Normally, right, pre-burnout, this person would have all the hope in the world that Seth was going to find employment and they could assist him in doing so. But because of that emotional exhaustion, they have become apathetic and numb. And that can be really harmful if we follow, that down the trail. Right? What does service look like when someone's providing it from that lens? Is it in conjunction with best practices? Is it in adherence to, our IPS standards, our psych rehab standards of holding hope for someone that they can achieve recovery, right? Those services might be diminished. Those experiencing burnout may treat colleagues and people engaged in service as objects rather than human beings. So that depersonalization, often cynical, detached, perspective shift, language shifts, services shift, right? Again, an example with Seth, right? That staff that I was supervising, they now lost hope and passion for the field. There's cynicism, pessimism, or hopelessness. And then there is that sense of low personal accomplishment, right? People who feel burnt out do not feel that their work is making a meaningful difference. They feel ineffective. They have negative feelings about themselves, Clinicians with burnout are unable to appreciate what they do for the people they work with and others in their lives. They just feel ineffective. And so you want to be mindful of this triad. Thinking about additional side effects of burnout. Burnout can cause a lot of adverse health events for staff. And this can include poor decision making in general, accidents on the job, or accidents outside of the domain of employment. It can include decreased attention, concentration, less empathy, personal health problems, including substance use, depression, anxiety, insomnia, fatigue, heart disease, obesity, hypertension, infections increase. This can lead to high job turnover, decreased productivity, challenges with coworker relationships, even early retirement. I think we saw a lot of that during the pandemic. People were just very burnt out. And so how do we go through burnout? It is in stages. The honeymoon phase, stage 1, is when we undertake new tasks. Your staff are going to be excited by doing their job. There is high job satisfaction, commitment, energy, bounds of creativity, right? This is especially true of a new hire, right? Someone in a new job role. In this first phase of burnout, you may begin to experience predicted stressors of the initiative you're undertaking. So it's important that people start, and specifically supervisors, start implementing coping skills, encourage those coping skill usage at that phase 1. The theory goes that if we create good strategies for addressing burnout at this stage, we can maintain that honeymoon phase indefinitely. So when you are in the honeymoon phase, when your staff is in the honeymoon phase, you see high job satisfaction, readily accepting of responsibilities. People are psyched to take on new initiatives, learn something new, work with a different person. There's sustained energy levels, right? No peaks and valleys. There's endless optimism, commitment to the job, a compulsion to prove oneself, free-flowing creativity, and high productivity levels. The second stage of burnout is an awareness that some days are more difficult than others, right? That onset of stress. Optimism may wane, and you may notice common stress symptoms affecting you physically, mentally, or emotionally. And this can look like difficulty focusing, irritability, some job dissatisfaction creeping in, some difficulties with sleep, maybe lower productivity, anxiety, avoidance maybe of decision making. You're no longer signing up for the projects. You're more hesitant, right? There could be headaches. Stage 3 is chronic stress. And this is a marked change in stress levels, going from feeling motivated to having that avolition, right? Experiencing stress on an incredibly frequent basis. And they may have symptoms from stage 2, and they may be more intense. This may look like missed work deadlines or targets, persistent tiredness in the morning, physical illness, procrastination at work, and now at home. It's creeping in to other life domains. Repeated lateness for work, feeling resentful, right? Staff feeling resentful, angry. Staff taking uptake of escapist activities. Put in the chat, what are some escapist activities that you have observed? I've seen people, using their phones a lot, right? Anger or aggressive behavior, apathy, exhaustion, cynical attitudes. And then when we start to see it move into the home life, we see problems at home, feeling pressured or out of control, usage of substances like alcohol or increased caffeine consumption. Stage 4, this is burnout. And this stage itself is where symptoms reach a critical threshold. Continuing at normal is not possible. And this looks like development of escapist mentality, wanting to avoid, not wanting to engage with work, feeling empty inside, right? Feeling like there's a loss of purpose. And you're just, again, very apathetic. That has taken over. Obsession over problems at work or in life in general, pessimistic outlook, not just at work now, but also in life, physical symptoms intensifying, right? The headache, the palpitations, things of that nature, self-doubt, isolation, social isolation for staff, not just at work, again, outside of work, behavioral changes, stomach issues, neglect of personal needs, and an increase, uptick in those escapist activities. A desire just to drop out of work, a desire to move away from work, friends, family. And then stage 5 is habitual burnout. The final stage of burnout looks like a lot of these symptoms escalated and they've become so embedded in your life that you're likely to experience an ongoing mental health, physical health, or emotional health problem, as opposed to occasionally experiencing stress or burnout. And this can look like chronic sadness, depression, chronic mental fatigue, chronic physical fatigue, etc. So thinking about these factors or these characteristics of the stages, what do we think are some causes of burnout? Go ahead and put that in the chat. What are some causes of burnout? Right? What do you see? What are your observations? Lack of boundaries, lack of support, increased client demands, not feeling supported by leadership, taking on a larger workload. Yes, all of these things. Very accurate. There isn't one contributing factor. There are a multitude of factors. Primary and secondary trauma from work. Yes, Michaela, trauma is impactful. Absolutely. If we're not in restorative supervision and we're just taking on that trauma, that is going to end up impacting where we're at on that burnout phase or scale. If anything else comes up, go ahead and put it in the chat. But there are a multitude of factors, and we see that these factors can be, in terms of categorization, they might fall into some of these categories listed, right? The key drivers of burnout, when these things are in absence, right? When there's an absence of these things, right? Less optimal status, then we're going to go higher on that burnout scale. When we experience an optimal amount of these things, right? When they're in an optimal range, then we can experience engagement and resilience in our work, right? These 7 dimensions include workload, which you mentioned, efficiency, right? Our ability to do our work and do it well, flexibility, control over our work-life balance integration, alignment of individual and organizational values, the support that we have, our social support, our community, in work, out of work, and the degree of meaning derived from work. Each of these dimensions influenced not just by the individual, but by the organization, right? It's 2-factored. And in our supervision, especially our restorative supervision, we can address these areas. And so that looks like, right, the reduction of burnout with organizations is best maintained through a combination of interventions at the individual and organizational level. And so what I'd like for you to do is in these next 10 minutes, I'm going to put you into breakout group rooms. We're going to try, I'm going to be daring. I'm going to try to do this. Let's see. I'm going to put you in rooms, and each room is going to take on one of these areas. I'm going to, in the chat, give you a Google Doc. And in your breakout group room, you're going to spend the next 10 minutes thinking about that one factor that you have. So for example, there's going to be group 1. And group 1 is going to go into that Google Doc. I just put the link in the chat. And they're going to think about control and flexibility at work. And in that Google Doc, you're going to write down on the second page, right? You'll see this chart in Google Docs. And then the second page, there's listed 1 through 7. Whatever you're assigned to, right? 1, 2, 3, whatever group number you are, that's the item that you're going to take on the chart, right? For example, group 1 is control and flexibility at work. Group 2, value and meaning in work. And you're going to write down what the organization can do, right? That's you, the supervisors. What can you do to support this area in a staff person's life in restorative supervision, right? So what can you do to support the staff person exercising control and flexibility? How can you assist that person? An example might be letting people determine what their areas of interest are in terms of working with certain folks. Maybe one person, like for me, I have an area of specialty in traumatology. I have a specialization in working with individuals with autism, right? So maybe I would, in my flexibility and control, have some say in working with some of those folks on my caseload, right? So you're going to put down your suggestions for each of these areas. Any questions before I send you into your breakout group rooms? Fingers crossed, this works. I'll see you back in 10 minutes. We'll have 5 to go over what you have reviewed. Are you guys able to access the rooms? They should be open.